Hi, I'm Dr. Paul Tortland, a specialist in primary care sports medicine and non-surgical orthopedics. I'm also a specialist in orthopedic and musculoskeletal regenerative medicine. I'm here to introduce you to the intelliFat kit by Cellmyx, which is a revolutionary new system for harvesting and processing lipoaspiration for regenerative medicine purposes. I've been doing regenerative medicine since the mid-1990s, when I started doing prolotherapy in 1994. In 2007, I began doing PRP. In 2008, I began doing bone marrow aspirations, and in 2009, I started doing lipoaspirations. Over the years, I've had the opportunity to use almost all of the commercially available adipose systems. The intelliFat kit by Cellmyx represents the next generation of lipoaspiration kits. I find it's the simplest and easiest to use, the most time efficient, and produces what I consider to be the highest quality final product for musculoskeletal regenerative medicine purposes. In this video, we're going to show you how to perform a lipoaspiration and processing using the intelliFat kit for musculoskeletal purposes. The kit can be used for aesthetics and plastics purposes, but for this video, we're just going to focus on the musculoskeletal components. We're going to show you how to perform the lipoaspiration, and then how to perform the processing. One of the unique features of the intelliFat kit is that the processing does not require centrifugation or a hood. Everything can be done right at the bedside in a matter of minutes. I hope you find the video helpful. You can always contact me for additional questions or contact the people at Cellmyx. Okay, let's introduce you to the various components of the intelliFat kit. Keep in mind that the kit that you have may differ slightly from this one. This one contains a bunch of items that are going to be used for plastics, such as these infiltrators right here, which we do not use for musculoskeletal. For musculoskeletal, we'll be using this infiltrator and harvester, and this will be the diamond resizer to break the adipose down into the microscopic clusters. And then if needed, this filter is used to help separate out the remaining tumescent fluid, oil and heme from the processing. We'll also be using the lure-to-lure transfer. We have our tumescent fluid already set up here. We have 120 cc's of that. We have the vac lock syringe, which we'll show you how to use. We have an 11-blade scalpel, and then we have an 18-gauge needle, which I'll show you how to use. All of the other components are really not essential for musculoskeletal work. Okay, so we have prepped the area in sterile fashion with chlorhexidine. We've applied our sterile drapes, and I've also anesthetized the skin in 2 locations on the back side here, and we anesthetize them with a mixture of lidocaine with epinephrine and a little bit of bicarbonate. Now what we're going to do is we're going to create our entry points, and our target is going to be getting into the adipose here in the flank and in the upper gluteal region. We want to avoid getting towards the medial aspect of the gluteal region because that's very rich in nerve endings. So our target is going to be from here down to about here on either side. So what we do is we take our 11 blade and we make a very tiny opening. Don't make this too big, just big enough to get your cannula in. And then what I like to do is get the 18-gauge needle and use the 18-gauge needle to do a little dissection of the underlying cutaneous fat, which will make it a little bit easier to get the cannula into the tissue. That way you don't have to use the scalpel to do any cutting. And if you've anesthetized properly, this is painless. But it makes it a lot easier to get that cannula in when you go to do the infiltration. Okay. So now we have our cannula, infiltrating cannula with our tumescent fluid. And this is a matter of personal preference, but I prefer to work on the opposite side. So I'm going to put the cannula in, and I go straight down first to get it in through the skin, and then get it into the subcutaneous tissue. Okay? The key here is, as you're infiltrating and harvesting, not to come so far out that the holes are exposed. Now, Jim, as I'm doing this, you might feel a little pinch as I'm numbing things up. It feels like little hairs being pulled out of the skin, okay? Now, important as I'm doing this is I'm going very, very slowly with the tumescent fluid. I'll actually advance this into the fat first, and I'm feeling with my hand where the tip of the cannula is, right under the skin. And notice that the cannula is staying very flat with, or parallel with the skin. And we go very, very slowly with the tumescent fluid. You don't want to dump it all in one spot. And we're slowly moving the cannula just in millimeter increments from side to side, slowly infiltrating as we go along. We're going to put 60 cc's on the one side and 60 cc's on the other side. Make sure you cover all of the areas that you plan on harvesting, because otherwise it will be painful and bloody. Okay, that's the one side. We'll do the other side. So now I've come around to the opposite side of the table, and we're going to do the same thing. Notice I come in perpendicular first and then angle to get into the adipose layer. And go very, very slowly with the tumescent. If you dump it all in one spot, then that spot will be very numb and the other areas will not. And the patient will not be happy with you. When done properly, this is almost a painless procedure. Patients will feel a little bit of pinching, but once everything's numbed up, if you've numbed it up properly, it should be essentially painless. Notice I'm feeling with this hand so I know where the cannula is at all times. So that's the tumescent infiltration. What we're going to do is we're going to cover our entry points. We're going to put a sterile drape over the top of this because we need to let this sit for 15 to 20 minutes. And the purpose of that is so that the epinephrine causes enough of a constriction of the blood vessels so that we don't get a bloody harvest, and also to allow the lidocaine to work fully. We will be back in 20 minutes. Okay, so we are back and the tumescent fluid has sat for 20 minutes. Hopefully we will have good hemostasis and anesthesia. And what we're going to do for the harvesting is we're going to use this 30 cc vac-lock syringe. Now what's unique about the vac-lock syringe is that the plunger actually has little ridges in it that will lock on a tab. So when you're on the open portion, the plunger will open smoothly. If you rotate the plunger, then you can engage the lock within a 5 cc range. So you don't need to have any other lock. And the nice thing about the vac-lock syringe is that you can have an infinite, almost an infinite number of positions, so it's not an all or none. The reason that this is crucial is because we now know that if you apply too much pressure during the harvest, that can actually cause barotrauma and kill the cells. So we don't want to apply more than 10 cc's of pressure, so we'll lock the syringe at 10 cc's and then just increase it by 10 cc's as we go along. So we're going to reattach our harvesting cannula, which is the same cannula that we used for the tumescent infiltration. Now sometimes what happens is during that 20 minutes, these little entry points start to close up. So I've got my 18 gauge needle. We're just going to open those back up again to make it easy to get our harvester back in. There we go, just like that. Now the key here is we want to insert the harvester the same way at a 90-degree angle, perpendicular, and then turn it and get it into the tissue. Before we do any harvesting, however, what we're going to do is pre-tunnel the adipose for at least a minute. And what the pre-tunneling does is it helps soften up the fibrous fat to make it easier to aspirate. And as you do this, eventually the fat will feel much more smooth and even. It's almost like a hot knife going through butter. If you encounter a lot of fibrous tissue, you want to keep working that until it softens up. Remember, there's no suction on the syringe at this point. I'm just using the cannula just to break up the adipose. And we have our assistant set a timer for 1 minute. But I go until I feel things are loosening up. And this hand, I'm feeling where the tip of the cannula is at all times, so I know where my cannula is in the tissue. And notice that that cannula is staying pretty parallel with the skin. You don't want to be going straight up and down. You want to stay parallel with the fascial planes. Okay, so we're at 1 minute. There's still a little bit of fibrous stuff up here I want to break up. There we go. So now you leave the cannula in, and then we apply our first 10 cc's of suction. And then we slowly harvest. And you can see we're starting to get a nice lipoaspiration. Nice and smooth and steady. Now, if you come too far out with your aspirating cannula, you'll lose the suction, just like that. If that happens, then you have to get the air out of the syringe. So we release our vac lock, cover the top of the cannula, express the air, and then go back in, and then reapply the suction. So you can see we've got about 7 cc's of adipose in here. So if I go up to the 15 point, again, just about 10 cc's of suction. Now, for our particular case here, we're only doing 1 knee. So I only need about 15 cc's or 30 cc's of harvest. So I'm going to get 15 cc's per side. And then we'll put a little more suction on that. So I'm just going in 5 cc increments. And you can see that's a nice clean harvest. There's no heme in that at all. Sometimes if the tissue is a little resistant, you can grab it and pinch it. That makes it a little bit easier to get the fat in there. And we're at 15 right there. So we're going to stop. We'll release our vac lock and we'll go over to the other side. So now I've come around to the other side. Again, we come in at 90 degrees. And then, again, we have to do our 1 minute of pre-tunneling here. And you can pull some of the fat up from the love handle areas here. This is a nice source of adipose right in here. You can also harvest from the belly, but we find that the flank tends to be a better source, a better quality of adipose. And there tends to be less inflammatory tissue in the flank and upper gluteal areas. So we're at 1 minute. So we're going to go from 15 to 25. So I'll turn this so you can see. We're right at 15. We're going to pull back to 25. That's going to be our 10 cc's of suction. And just nice and gradual, work back and forth. Don't make big sweeping movements. Oh, just lost my suction there. So we're going to come out. We're going to release our vac lock, get the air out. and put it back in. And then we're at 20 right here, so we're going to go to 30. And you can see how simple and easy this system is to use. You get a really good clean harvest. Of course, the quality of your harvest is going to depend on the quality of your tumescent application. So if you did a good job with your tumescent infiltration, then you should get a really good clean harvest. Now, if we were doing more than one joint, I would take 60 cc's of adipose. But since we're only doing one knee, all I need is the 30 cc's. And I like to take an even amount from both sides. And there we go. There's no more suction left on the syringe. And we've got a beautiful clean harvest. And we'll show you next how to process this. So we've taken our lipoaspirate and we've put a cap on the syringe. And we've placed the syringe in a syringe stand so that we can start to gravity decant. And as we zoom in, you can see that we're already getting a good separation of the layers. And we'll let that sit for a few minutes.
Okay, so we've taken the key components from the intelliFat kit and we've transferred them to our processing tray. We have the diamond cut resizer and the MilliFat filter. We've taken 4 10cc syringes, the transfers, some tip caps, and then we have sterile saline, some extra syringes for washing, a waste basin, and a syringe holder. Our lipoaspirate is not bloody at all. So for this, we don't need to do a wash. It looks really good. But for demonstration purposes, we will be showing you how to wash this aspirate. We've been gravity decanting this for about 3 to 5 minutes. So now we're going to decant off the tumescent fluid and the heme that's on the bottom. Like I said, there's very little. And you can see there's the tumescent fluid, the fat, and then some oil. So the stuff right in the middle is what we want to process. So I'm just going to take the tip cap off, and I'm going to keep the syringe vertical, and I will decant the fluid, making sure that the vacuum lock is not in place. So you want to go nice and slow and easy, and you're just going to decant until you get to the fatty layer. You can also use this MilliFat transfer to help you do this. As you put this on, it'll stop once you hit resistance with the fluid, when the fluid is gone. So now what I'm going to do is I'm going to apply a transfer, and I'll show you some washing. So I'm going to put, if you have a big amount of harvest that you need to wash, you can do it in a 60 cc syringe. I'm not going to wash very much because we don't need to. So I'm only going to wash about 10 cc's. But you could wash 20 or 30 at a time, and you do half and half. You do half aspirate to half sterile saline. So I'm going to put 10 cc's into here. Just like that. And just some tips and tricks to keep things less messy. You want to pull down on other syringes to make it so that you don't get stuff everywhere. So now I have 10 cc's in here, and then I'm going to transfer 10 cc's of sterile saline. So pull back on the bottom syringe so you don't have fluid leaking everywhere. And now we're going to pass this back and forth about 10 times. Just to really wash out any extra heme that would be there if this was a bloody aspirate. Okay. Loosen the top one just a bit and then pull back on the bottom. So now that we've washed this, we're going to let this gravity decant again. About 3 to 5 minutes. So while that decants, I'll go and I'll move on to not washing. So we'll put on that transfer, and I'll take, you don't want to use larger than 10 cc syringes because that creates too much pressure in here and will break this apparatus. So you only want to do 10 cc's at a time. And while keeping this upright, I'll transfer 10 cc's over. And I want to make sure I stop before I get that oily stuff, which is just about 10 cc's. So you can start to see there we're pulling off oil, and we really don't want to get too much oil in there. So I'm going to pull that oil back because I don't want it. Good. And now we're all done with this aspirate. And I'm just going to move that over there. Put it over here. Okay, so now we have a 10 cc syringe full of the aspirate. We're going to attach it to the diamond cut resizer. You don't want to put it on too tight, but just finger tight is good. And then we'll put an empty 10 cc syringe on the other side. What I like to do is I also like to push, because there's airspace in here, I push it through this resizer just until it comes to about the top, so that way you have less air in the syringe. Okay, and then you're going to pass this through 40 times. All right, so I'll take off the top, and as I do that, I'm going to pull down on the bottom syringe. There is lipo-aspirate left over in the diamond cut resizer, so you do want to pull back to make sure you get all of that sample out of there. There. So we've got about 9 cc's in here, and then we'll just turn this way. We will gravity decant this as well. There might be a level of heme, there might not. We already decanted most of the heme, so there probably won't, but sometimes there will be a little. And then sometimes you can get a frothy layer up here that's a lipid layer. We don't want to inject the lipid layer, so we want to keep that froth at the top, and we'll keep all those things separate. So I'll put this in there to gravity decant for a bit and see what we've got here. So you can see here we've got the fluid here on the bottom and the lipo-aspirate here on the top. I'm going to show you how to use this milli filter at this time. So this will help us in the decanting process. You can use this or you don't have to. But what happens here is that only the fluid will pass through this filter. Let me move this so you can see a little bit better. Only the fluid will pass through this filter. Once the fat gets to the filter, the fat cells are too large to pass through the filter, so it'll stop. Okay. This just makes decanting a little bit easier if you're not comfortable knowing when to stop. And you'll just hit resistance once the fluid is out. So there I've started to hit some resistance there. This will make for a very dry lipo-aspirate. There will be no fluid in here at all. So if you're doing something where you want a little bit of fluid in the aspirate, you wouldn't necessarily want to use that. So now we're ready to go here to send this through the diamond cut resizer. It's important, again, to transfer this to a 10 cc syringe just to make sure that we don't put too much back pressure on the diamond cut resizer. Again, pushing it a little through so we don't have a bunch of air, and then passing it through 40 times. All right, and then pull back. Once you take the top one off, you're gonna pull back to get the excess in the resizer. And then you'll flip this over for decanting. Like I said, the decanting on these will most likely not need anything. You can see here that we haven't seen any real change in this aspirate here because we decanted in the beginning. At this point in time, this lipoaspirate is ready to be injected. We do recommend putting it into smaller syringes. 1 cc or 3 cc syringes work the best for re-injection and for the most smooth transition while injecting. But this is ready to go.